Now, day one of fresh curbs kicks off in the national capital, Delhi, and long queues were witnessed today right outside several metro stations and crowded bus stops as services operated only at 50% capacity. Metro commuters faced difficulties as crowds piled up, flouting social distancing norms amid the Omicron scare. Crowds of devotees were also seen last night at the iconic Hanuman temple and other religious places. Delhi Disaster Management Authority has also been trying to take stock of the situation. They're all set to be meeting today to discuss current COVID situation. LG Anil Baijal, Chief Minister Arvind Kejriwal and senior officials along with experts will be meeting. In fact, Delhi's positivity rate has risen to 0.8% and Omicron count has touched to 238, out of which 57 people have recovered, according to latest data from the Health Ministry. Schools, colleges, cinema halls, gyms, spas are all closed in Delhi. Shops of non-essential goods and services in markets and malls are opened on an odd-even formula from 10 a.m. to 8 p.m. Restaurants are permitted with 50% seating capacity from 8 a.m. to 10 p.m., while bars can also operate with the same capacity, but from 12 noon to 10 p.m.
अभी तक एक भी पेशेंट को ऑक्सीजन लगानी नहीं पड़ी है जो ओमिक्रॉन से पॉजिटिव रहे हैं और सभी लोग बिल्कुल ठीक होकर चले गए हैं। पॉजिटिविटी लगभग 1% के आसपास चल रही है। ऐसे हैं कि जो बाहर से लोग आए हैं वो थोड़े दिनों बाद पॉजिटिव हो रहे हैं, तो उनके कांटेक्ट के लोग या उनके घर के लोग ज़्यादा हो रहे हैं। फिर भी सभी को सतर्क रहने की ज़रूरत है।
All right, now 212 days after, financial capital Mumbai has now reported more than 1,000 new coronavirus cases. The Omicron count is 167 in Maharashtra, with 72 people beating the infection. The city has reported 1,337 new cases and one death on Tuesday, a 70% jump in its tally on Monday. With this surge, the active cases in the city has soared past 7,000. Maharashtra's total tally has now seen an uptick owing to surge in Mumbai. The state reported 2,172 new cases. Maharashtra now has over 14,000 active cases of COVID-19.
मुंबई का पॉजिटिविटी रेट अभी 4% हो गया है, तो 5% तक अगर पॉजिटिविटी रेट जाता है तो हम जब सेकेंड वेव में थे तब ऐसा ही कुछ 7-8-10% का पॉजिटिविटी रेट था, लेकिन 5 के आगे का पॉजिटिविटी रेट निश्चित तौर पर बहुत ही अलार्मिंग होता है। तो हमें रेस्ट्रिक्शंस के बारे में भी गंभीरता से सोचना पड़ेगा। वैक्सीनेशन ड्राइव और अच्छी तरह से किस तरह से हम कर सकते हैं, और रहा सवाल कोविड अप्रोप्रिएट बिहेवियर को भी और स्ट्रिक्टर मोड पे हम किस तरह से ला सकते हैं, यह हम विषय ऊपर चर्चा माननीय मुख्यमंत्री जी के मीटिंग में होंगे।
Well, now another COVID scare has gripped Bollywood as a number of celebrities have tested positive. Actor Arjun Kapoor, along with his sister Anshula Kapoor, have tested positive for COVID-19. Both are currently in home quarantine. Arjun's girlfriend Malaika Arora will also be tested soon. Sonam Kapoor's sister Riya Kapoor has been tested positive, along with her husband Karan Bulani. The focus will now be on contact tracing to find all those who've come in contact with these celebrities. It's not clear now as yet if at all this is the Omicron variant. This is the second time that Arjun Kapoor has tested positive for COVID. In a matter of weeks, a number of Bollywood celebrities have tested positive. Earlier this month, the likes of actors Kareena Kapoor Khan, Amrita Arora, Seema Khan, designer Maheep Kapoor as well have tested positive. Maheep's daughter Shania Kapoor has got her results and that also seems positive. All right, now with less than a week to go for vaccination drive to open up for kids between the age of 15 to 18, India is now prepared in full swing. Many states now trying to come together with a tally of number of kids or children within each of their states. Maharashtra to Tamil Nadu to Delhi. Here's how states are now gearing up to administer doses for teens.
gearing up to vaccinate its teenagers. The vaccination drive for 15 to 18 years old will start on 3rd January. They can only be administered the Covaxin shot. The beneficiaries will have to book their slot on CoWIN website. With less than 1 week to go, all states in India are preparing to vaccinate its young population, especially in view of the anticipated surge in Omicron infections. In Delhi, the eligible children will be vaccinated at the existing centres. They will be administered jabs at government schools and government and private hospitals. In Maharashtra, the number of eligible teenagers for the vaccine is being ascertained. 3.7% of the state's population is likely to be vaccinated. The state of Tamil Nadu is also gearing up to inoculate 33.2 lakh children. Assam's state departments and district administration are planning to administer vaccines to 18.25 lakh teenagers. And in Haryana, nearly 16 lakh eligible children will receive their first jab. The state government is collecting data on all school-going children. Children who were vaccinated in the trial phase have received their vaccine certificates.
जो पहला डोज लिया तब मुझे थोड़ा सा तो डर लग रहा था कि वैक्सीन लेने के बाद क्या होगा, क्योंकि ट्रायल में ले रहे थे, बट वैक्सीन लेने के बाद कुछ प्रॉब्लम्स नहीं आए हमें और कुछ भी जो हमें था वो कुछ हुआ नहीं हमें।
ये घोषणा जो प्रधानमंत्री जी ने की है वो उसके बैकड्रॉप में मैं उन सभी लोगों को कांग्रेचुलेट करना चाहूँगा जो बच्चों ने और उनके पेरेंट्स ने ये वैक्सीन की ट्रायल लेने की हिम्मत की और आज उनकी हिम्मत की भरोसे ही ये ट्रायल सक्सेसफुल होने के बाद बाकी सभी बच्चों के लिए ये वैक्सीन ओपन की जा रही है।
With Omicron cases on the rise, India is leaving nothing to chance by opening up vaccination to the younger population. Bureau Report, India Today.
Now, doctors have clearly wondered at the reasons to why there are long-lasting COVID effects and that it really affects many organs of the body for a long period of time. A breakthrough study now done on the COVID dead in the United States tells us that COVID stays in the human body for months even after recovery. Here's more on that.
2 years into the pandemic and countless cases of people suffering from long COVID. Some had difficulties in getting back to a normal life months after recovery. Scientists today have found some answers behind the extended illness. Scientists at the US National Institute of Health said they found that the virus is capable of replicating in human cells well beyond the respiratory tract in the human body. Because SARS-CoV-2 spreads within days from the airways to the heart, brain and almost every organ in the body, where it may stay for months. Studies say the delayed viral clearance is what leads to persistent symptoms of long COVID. Scientists have detected persistent SARS-CoV-2 RNA in the brain for 230 days. Infection of the lungs could lead to virus spreading in the bloodstream or viremia in mild cases. Results were based on samples taken from autopsies of 44 COVID dead patients. Indian medical experts have called the study a breakthrough in understanding long COVID.
It means it is not only limited to respiratory tract, the lungs, it could go into any part of the body, which includes heart, brain, etc. And all these long COVID symptoms like neuropsychiatric manifestations, seizures, brain fog, etc., they can all be found.
We have seen that even after recovery from COVID, the patients continue to have different symptoms. They were never fully comfortable, they continue to have symptoms. So there was always a concern that probably COVID virus has caused permanent damage to the organs or it is due to the persistence of the organs.
Less viral clearance outside the lungs is related to weak immune response in the body in early stages.
ऑटोप्सी स्टडीज़ में ये पाया गया कि कई बार ये इन्फेक्शन करीब मोर देन 290 डेज तक वायरस, एक्टिव वायरस या रेप्लिकेटिंग वायरस बॉडी के अंदर था। तो ये दर्शाता है कि इन्फेक्शन इमीडिएटली आप दवाई दें और तुरंत से ठीक हो जाए, ऐसा नहीं है, ये मिथ है। तो इसलिए, और ये नहीं है कि हर केस के अंदर ये वायरल इन्फेक्शन जो है इतना लंबा चलेगा.
The results of the study, published in the science journal Nature, is yet to be peer-reviewed. But doctors are beginning to understand that COVID is multifaceted, systematic disorder.
Emerging scientific data now shows that reasons for brain fogging as well as neuropsychological manifestations of COVID have led to people suffering from long COVID for several months. As more such studies emerge, it will be known soon that influenza is not what COVID is all about, and it is ultimately a multi-systemic disorder infecting the whole human body. With Pawan Kumar, Milan Sharma for India Today.
Sleep, sweet dreams and a happy and healthy mind and body go hand in hand. There are ways to fix your sleep cycles. After all, lack of sleep has far-reaching physical and mental health effects as well. Consequences. Why is sleep really important and how can you help yourself sleep better? Here's a report. Chaiti Narola brings it.
Fatigue, anxiety, irritability, lack of concentration, forgetfulness, exhaustion. If you go through all of these or some of these regularly, you may want to maintain a sleep diary and consult a neurologist or a psychiatrist. These could be telltale signs of sleep deprivation.
Now, a common question asked many a times is, how do I know that I'm sleep deprived? And of course, apart from feeling tired, when you wake up feeling, exhausted or tired, that's one of the common symptoms. But apart from that, excessive, sleepiness, yawning, lack of concentration, headaches, irritability, just feeling exhausted and tired, even sometimes forgetfulness and anxiety. So those could be the early symptoms that you're getting sleep deprived, and it's time to catch up and cover up for that sleep, deficit that you are creating.
The body's ability to function declines if one does not get enough sleep according to one's age. But what is optimal sleep for different age groups?
Now, the amount of sleep varies with age. For example, newborns require 14 to 17 hours of sleep, while infants from 12 to 15. Now, as the babies grow older, when they're children, 9 to 11 hours, and adults typically require 7 to 8 hours. Recommended is actually 7 to 9, and as older adults, 7 to 8.
If you don't get the optimal level of sleep, you are sure headed for some health trouble. It is almost an open invitation to different illnesses and also makes you age faster.
When one does not sleep, the required amount on a regular basis, over time, there's definitely an impact on the health of the person. Whether it's an increase in diabetes, whether it's an increase in the risk of heart disease or stroke, whether there's an increase in memory issues. In fact, one study showed that when people sleep for less than 4 hours continuously, they actually age by 8 years. So imagine your brain is functioning now at a level of 8 years older than what you would want it to be. And that can really impact you when it comes to functioning.
Along with physical health, lack of sleep even has an impact on your mental health.
Lack of sleep can have an impact both on the physical and the mental health, right from feeling tired to getting irritable to making mistakes at work to also losing concentration and losing your memory in the long run. A lot of people who have sleep disturbances have daytime drowsiness, and because of that it becomes very difficult for them to continue to do any proper work, and they may be taking naps in the day. As a result of this, over the long term, it impacts their relationships and can also cause depressive disorders related to sleep disturbances.
This is a very, again, an underappreciated topic, but mental health definitely gets affected by lack of sleep. Over time, people are more prone to anxiety, depression, panic attacks. So that is why it's important to actually have a regular sleep pattern. Especially for people who are prone to anxiety or prone to depression, it is important that they try to wake up and sleep at the same time.
But why does sleep deprivation even occur?
The problem of why sleep deprivation occurs can also definitely be behavior related. Nowadays, due to all the screen time that we all have, what we don't realize is that the amount of screen time that we show our brain, our eyes, our brain, there is actually more production of cortisol and less production of melatonin, which is required for sleep. And cortisol is what keeps us active. Apart from that, health issues, hypothyroidism, some people might have obesity, that will also contribute. If somebody is obese, they're not going to get a restful sleep. They might be snoring at night. That was they're not getting enough oxygen, so that is sleep apnea. That could also be a problem. Then apart from that, the most common, of course, personal obligations and work obligations, especially in the younger generation.
Sleep deprivation can occur because of a lot of reasons, right from aging, where people find it difficult to sleep as they grow older, to sleep disorders like sleep apnea or restless leg syndromes, or if there's an underlying psychiatric disorder, also people find it difficult to sleep.
All of this is fixable. Firstly, maintain a sleep diary if you are unable to sleep. Then, consult a neurologist or a mental health practitioner like a psychiatrist. Ensure you are being monitored by any of these doctors. There are some quick fixes too if your sleep deprivation is not chronic in nature.
The purpose of the apps is to actually see how well you're sleeping. When it comes to from clinical, neurology perspective, or when I practice, we give something like a 2-week sleep diary that is recommended, For good sleep, there are a couple of things one can do that are easier to actually follow. First thing would be set a routine. Make sure you kind of stick to a sleep pattern. It's very easy to kind of waver, but the more you can follow the sleep pattern, the better your brain regulates the circadian rhythm or the rhythm of how one wakes up and sleeps in your body, and that affects your entire sleep overall. Avoid having caffeinated drinks, avoid having alcohol. One might think alcohol actually helps. Alcohol might initially help you relax, but it does not help in prolonged sleep. So if you're somebody who has trouble sleeping a lot, avoid that nightcap as much as you can. That may not be something that you should be doing. Other things that you can do is, of course, taking away your screen time at night. Please keep away your phone, keep away your laptops, as much as you can, because the more you stimulate your brain, the more you're actually reducing the production of melatonin, which is the sleep hormone required for sleep.
Sometimes, we see that, it's just too much coffee which is not allowing a person to sleep, or taking too many stimulants. And incidentally, these are the people who also use alcohol at night to sleep. So the first thing is that we need to find the underlying cause and treat it accordingly.
After all, when kids were studying poems, very early on in their life, it is drilled into them, perhaps for a reason, that early to bed and early to rise makes a man healthy, wealthy and wise. Time to revisit it for real. Meanwhile, here's wishing you some sweet dreams. In New Delhi, Chethi Narula for India Today.